Hi, I'm Dr. Datis Kharrazian, and I want to talk to you about why patients that are on thyroid replacement sometimes feel much worse um, on their form of therapy. Sometimes it's not obvious. Sometimes you have patients that you'll do a history with them and they'll say, I forgot to take my thyroid medications over the weekend and I felt great. Now, first of all, we know that patients that have high TSH hypothyroidism should definitely be on replacement. And if they're not on replacement, their rates of neurodegeneration go up, they lose bone density, bone quality, they're more prone to develop gallstones, they have increased risk for cardiovascular inflammatory reactions in their blood vessels. They can really throw off their pituitary, ovarian, or pituitary testicular feedback loops. So they can really impair their gut health, their intestinal motility, their gut regeneration. So it's absolutely essential for patients that have high TSH hypothyroidism to be on some form of replacement to control the loss of ability for their thyroid follicular cells to produce thyroid hormones and to normalize their physiology. However, there are some patients when they go on replacement, they do feel worse. And one of the reasons is some patients with Hashimoto's and hypothyroidism really have sensitivity to the fillers. So the fillers in many thyroid forms of replacement have cornstarch as a filler, or they have soy, or they have different types of dyes that many patients that have autoimmunity start to react with. So one of the things that you really want to understand is the patient having reactions to fillers. Sometimes a patient with Hashimoto's takes thyroid hormones and they just feel overactive and they just can't tolerate it, and that could be because the forms of thyroid replacement that they're taking is actually a bioidentical source that always has some T3 in it. And when some patients have Hashimoto's, they have these relapsing, remitting flare-ups of their thyroid gland, and when their thyroid gland gets destroyed, there's some release of thyroid hormones from their tissues into their bloodstream, and then they get this hyperactive state, and that in combination with some type of bioidentical has some T3 in it really makes them feel a lot worse. There's also reported cases of patients that actually develop antibodies to their own T4 and T3, and that creates its own vicious cycle. So one of the things that we're going to be talking about in the Kharrazian Institute Hashimoto's Clinical Strategies and Treatment Application course is all these different factors when it comes to replacement. How to determine if there's reactions to fillers, what are your options, what's the best approach for the patient when they're looking at an individualized approach to thyroid. Should they be on a bioidentical T4, T3? Should they be on a synthetic T4, T3? And there's very important concepts to understand about each of those mechanisms. So the worst thing that a practitioner can do is have a bias and go, I only use bioidentical, or I only use this form of thyroid replacement. And that is not effective when you look at all the different diverse reactions that can take place with thyroid reactions. So we're going to go over these in great detail in our course, and hope you can join us for the Kharrazian Institute Hashimoto's Clinical Strategies and Treatment Application. Thank you for your attention.